A lot of people search for what a healthy blood pressure really looks like after 60. And honestly, it's one of the most reasonable questions you can ask. Because if you've ever sat in a waiting room, watched the cuff tighten around your arm, and then heard a number that left you feeling uncertain, you know exactly why this matters. My name is Dr. Frank Briggs, a retired family physician. I'm 67 years old, and for the better part of a decade, I've been trying to understand what it actually means to take care of your heart as you get older. Not what the posters on the wall say, not the quick 3-minute conversation before the doctor moves on to the next patient. What it actually means in a real life with real trade-offs. So let's talk about blood pressure. And more importantly, let's talk about what those numbers really tell us and what they don't. If you've been told your blood pressure is high, or if you're watching it creep upward year by year and wondering when to worry, stay with me. We're going to cover the direct answer first, then spend some time on the context that most charts leave out. And I think by the end of this, you'll feel significantly less confused. Let's start with the basic question. What is a healthy blood pressure after 60? The most commonly cited guideline right now is below 130/80. That's the threshold that many medical organizations currently use to define normal. If your top number, the systolic, is below 130, and your bottom number, the diastolic, is below 80, you're generally considered to be within a healthy range.
But here's the first thing I want you to know. That number was not always 130. For a long time, the standard was 140/90. And before that, there was an old rule of thumb that said your systolic pressure could naturally be your age plus 100, which would put a 70-year-old at 170. That's no longer considered acceptable guidance, but I mention it to make a point. The definition of normal has shifted multiple times in the last few decades. That doesn't mean the science is wrong. It means it's evolving. And it means that a single number on a single Tuesday afternoon is never the whole story. Now, where people often get confused is this. They see 130/80 as a hard wall. You're either healthy or you're not. And that kind of binary thinking, while understandable, doesn't really match how the body works, especially as we age. Here's what charts don't always tell you. Blood pressure is not a fixed number. It's a moving target. It changes throughout the day. It rises when you're stressed, when you're cold, when you've just walked up a flight of stairs. It drops when you're relaxed, when you've been sitting quietly, when you've just had a good night's sleep. Measuring it once and treating that number as your permanent reality is a little like checking the weather at noon and deciding that's what the whole day will be. What your doctor is really looking for is a pattern, a consistent picture over time. And that's worth understanding because it changes how you relate to the number when you see it.
There's also something specific to aging that deserves a careful explanation. As we get older, our arteries naturally become a little stiffer. This is called arterial stiffness, and it's a normal part of the aging process. It doesn't mean your arteries are broken. It means they've lost some of the elasticity they had when you were younger. One consequence of this is that your systolic pressure, the top number, tends to rise slightly with age, even in people who are otherwise quite healthy. This is where the nuance really matters. A 65-year-old with a blood pressure of 135/78 who exercises regularly, sleeps well, has no diabetes, no kidney disease, and low stress may actually be at significantly lower cardiovascular risk than a 45-year-old with a pressure of 128/82 who smokes, sleeps poorly, and carries a lot of chronic stress. The numbers alone don't tell you that. I want to offer you a simple framework for thinking about blood pressure rather than just reacting to the number. Think of it as 3 layers. The first layer is the number itself. Yes, it matters. If your systolic pressure is consistently above 160, that warrants a real conversation with your doctor. High blood pressure over a long period of time does put stress on your heart, your kidneys, and your brain. That's not fear-mongering, it's physiology. But even here, the goal isn't a number. The goal is reducing risk over time. The second layer is your overall cardiovascular picture. Your blood pressure reading is one variable among many. Cholesterol levels, blood sugar, weight, physical activity, sleep quality, stress, these all interact. A blood pressure that might be concerning in one context can be far less worrying in another. We'll come back to some of these variables in a moment because they're where your real leverage is.
The third layer, and this is the one that often gets the least attention in clinical settings, is what's actually driving the number. Stress elevates blood pressure. Loneliness elevates blood pressure. Chronic poor sleep elevates blood pressure. Pain elevates blood pressure. And some medications, even common over-the-counter ones like ibuprofen or certain cold medicines, can push blood pressure higher. If your numbers have climbed recently, it's worth asking, what has changed in my life? Not just in my diet, but in my stress, my sleep, my social world. This brings me to something that I think is genuinely underappreciated. Blood pressure is deeply connected to your nervous system. When your body perceives a threat, real or emotional, it triggers a cascade of responses designed to prepare you to fight or flee. Blood vessels constrict, your heart pumps harder, your pressure goes up. This is normal and healthy in the short term. The problem is that for many of us, especially those navigating retirement, health changes, loss, or uncertainty, the nervous system never fully gets the signal that the coast is clear. The low-level alertness stays on, and over time, that has measurable effects on the heart. So when we talk about managing blood pressure, we're really talking about managing the conditions of your whole life. Sleep is one of the most powerful blood pressure regulators we have, and it's completely free. Meaningful relationships, a sense of purpose, regular gentle movement, time spent outside, these are not soft add-ons to the real medicine. For many people, they are the real medicine.
Now, what are your actual options if your numbers are running high? The first path is lifestyle adjustment, and I'd encourage you not to roll your eyes at that phrase because when it's done thoughtfully, it can have remarkable effects. Reducing sodium intake has real documented impact on blood pressure, particularly in older adults and people who are sodium sensitive. Regular aerobic movement, walking, swimming, cycling, even 30 minutes most days can lower systolic pressure by 5 to 10 points over time. That's equivalent to what some medications achieve. Stress reduction practices, whether that's meditation, gentle yoga, prayer, time in nature, or simply protecting your sleep, can make a measurable difference. The second path is medication, and there's no shame in that. Blood pressure medications have an excellent safety profile for most people and can meaningfully reduce the risk of heart attack and stroke. If your doctor recommends medication, it's worth having a real conversation about which type, what the side effects might be, how it interacts with anything else you take, and what the goal actually is. You are entitled to understand what you're putting in your body. The third path, and this is valid, is watchful waiting with active monitoring. If your numbers are mildly elevated but you're otherwise low risk, some people and their doctors choose to monitor carefully while implementing lifestyle changes before committing to long-term medication. This isn't denial, it's a reasonable, informed choice. What matters is that it's a choice made with full information, not avoidance. These paths are not mutually exclusive. Many people do all three in different proportions at different times in their lives. I also want to mention one thing that often surprises people: white coat hypertension. This is a real and well-documented phenomenon where a person's blood pressure reads significantly higher in a clinical setting than it does at home, simply because of the anxiety of being measured. Studies suggest this affects somewhere between 15 and 30% of people who appear to have hypertension. If your readings at home are consistently lower than what you see at the doctor's office, it's worth tracking that and sharing it. Some people use home monitors. Others do ambulatory monitoring, where you wear a device for 24 hours. Either way, a fuller picture is always better than a single data point. So let me bring this all together. A healthy blood pressure after 60 is generally considered to be below 130/80, though context matters enormously. Arteries naturally stiffen with age, which tends to push the top number higher. The goal isn't perfection, it's understanding your own trend, your own risk factors, and the levers available to you. Blood pressure is not just a cardiology question, it's a whole life question. Your sleep, your stress, your relationships, your sense of meaning, these are not secondary factors, they are central. The number on the cuff is one data point. What you do with your days is the story. Here's the reflective question I'd like to leave you with, and I mean this genuinely. If you think about the last 3 months of your life, what has been the dominant emotional tone? Have you been resting well? Have you felt connected? Have you had things to look forward to? I'm not asking this to make you feel guilty. I'm asking because the answers to those questions may tell you more about your cardiovascular health and your options for improving it than any single reading ever could. If you have thoughts on this, or if there's a specific aspect of blood pressure or heart health you'd like to go deeper on, I'd genuinely love to hear from you in the comments. Not because engagement numbers matter to me, but because these conversations have a way of helping all of us think more clearly. Take good care of yourselves, and I'll see you in the next one.
Kindly support our channel by subscribing if you want more mind-opening content like this.